Okay, so now we're going to break the procedure down step by step. So I have washed my hands
I have to.
and I put on gloves. We greeted the patient, verified their name, their date of birth, so we know we have the right patient. We verified the orders. We know what test we're doing for the patient. So then, you take the tourniquet. Tying the tourniquet takes a lot of practice. So you're really just going to pull the ends tight. You're gonna hold with your non-dominant hand, you'll hold it. And then you're gonna cross over with your dominant hand, like you're gonna tie your shoes, but only halfway. And then we leave this tail, so once we're finished, we can just quickly pull it and release the patient. So now, we've already palpated for the vein. We know we're gonna go here. We'll take our alcohol. When you clean it with the alcohol, you start where you're going to stick. You work in a circular motion and you go about 2 inches from the site. Give the alcohol a little bit of time to dry. Make sure you have your equipment ready, because how long can we leave the tourniquet on for, Brianna?
Until we put 1 minute. No, 1 minute.
1 minute, yes. We do it for 1 minute. Yes. So now the patient has the tourniquet on. We've cleansed the site. We've let the alcohol dry. We have their consent. We are going to get ready to draw the blood. Make sure all of the equipment that you need is on one side. You don't want to stick him and then switch hands and have to cross over. You don't want to do that. Once you stick with this, then that hand is going to stay planted. Now I want you to see the way that the needle is slanted. There's a slant. And you're going to hold the skin tight. But I'm going to move my hand so you can actually see the motion to stick. Place your 2 fingers on the patient's skin. You're going to rest the hub on your fingers. You're going to stick. You should feel a little bit of resistance, and then that resistance is going to give. You'll take your tube. Remember, you're going to use your flanges, these things where your pointer and your middle finger are, and you're going to use your thumb to push the vacutainer. And you're going to allow your tubes to fill up. If I had to change tubes, I'm still going to anchor this as tightly as I can. You don't want that needle moving around in the patient's arm. So let's say I'm going to get a second tube. Same thing. Anchor it, use your flanges, push with your thumb. And now we've noticed, okay, the blood has stopped. We've gotten all the blood we need. So we're going to do tourniquet, pull the tail, take the tube out, and then with our needle, we're gonna pull straight out. This one has a different security, but it's still the same concept. We have secured our sharps. Place it in the biohazard. We have our Coban ready. Remember to have your patient keep their arm flat. You don't want them to get a bruise or a hematoma because the blood has pooled in that area. It's hand tear, might not be pretty. And then he's good to go.